Hi, my name is Dr. Vanita Noronha and I am a medical oncologist. I practice at Tata Memorial Hospital in Mumbai, India. I take care of patients with lung cancer, esophagus cancer, head and neck cancer and genitourinary cancers. So I have been attending Lung Connect for the last several years, which is really to my mind one of our most important resources. So in Lung Connect, patients with lung cancer attend this. It's a patient support group, and we initially used to have an in-person meeting once a month. It became once every 2 weeks, and then when COVID started, we were having it every week. So what I felt is that when I attended it, I found that there were so many different questions that patients had that, maybe patients feel inhibited in the OPD, or we just don't have the time to spend that much time with each and every single patient. But when patients come together, there are many common questions which get answered here in this forum. So I found it really very satisfying that I could actually solve so many problems and very simple problems, and many times as a physician and as the oncologist, we don't think about this, like how there were so many patients during the pandemic who were not able to buy a simple tablet called Gefitinib, which is a remarkably effective tablet, but it was just not available. And there were places it was available, but those places were not known to the patient. So it was so satisfying that we were actually in a very simple Zoom meeting, we were able to solve these kind of problems, which were actually life and death problems. So the patient was not able to get the tablet. We were able to make it available, let them know where it could be obtained. So I think this is really important, and the next step is a patient advocacy group that we think is really important. This is ultimately the voice of the patients, and whatever we do every day is to improve outcomes of patients, and that voice needs to reach a critical mass in India. There are very successful patient advocacy groups around the world which have driven patient care, they have driven research innovation, they have driven the development of new drugs, just because this is a need that patients feel. And that I think is sorely lacking in India, and that is something that we have to work upon. I wish Lung Connect the very best of luck.